This is Democracy Now!, democracynow.org. I'm Amy Goodman. We turn now to several confirmation hearings on Capitol Hill for President Trump's cabinet members, beginning with Robert F. Kennedy, Jr., who faced a second day of hearings for Health Secretary. Kennedy has previously campaigned as pro-choice, but during the hearing, he repeatedly said he believes, quote, every abortion is a tragedy, and vowed to implement Trump's policies. He also gave incorrect information about Medicare and Medicaid. Kennedy's long record of vaccine skepticism was a major focus. He repeatedly refused to disavow the debunked link between vaccines and autism and refused to acknowledge COVID vaccines are life-saving. But he ended with this claim.
Before I conclude, I want to make sure this committee is clear about a few things. News reports and many in the hearing yesterday have claimed that I'm anti-vaccine and anti-industry. Well, I'm neither. I'm pro-safety. I'm pro-good science. I worked for 40 years to raise awareness about mercury and other toxics in fish, and nobody called me anti-fish. All my kids are vaccinated. I believe vaccines have saved millions of lives and play a critical role in healthcare.
In the same hearing on Thursday, Kennedy defended his trip to Samoa in June of 2019, 4 months before a measles outbreak was declared that killed 83 people, mostly children. Kennedy's anti-vaccine nonprofit, Children's Health Defense, offered to finance the trip. This is Democratic Senator Ed Markey of Massachusetts questioning Kennedy about that trip.
So let me just follow through now, 2019. So now in October of 2019, the CDC declared a measles outbreak in Samoa. And in November, Samoa started a mass vaccination campaign to stop the outbreak. That same month, November of 2019, after 16 people had already died from the outbreak and Samoa was trying to respond to the crisis, you sent a letter to the Prime Minister of Samoa stating that, quote, it is a regrettable possibility that these children are causalities of the vaccine. By unanimous consent, I will introduce that letter into the record.
Without objection.
So as Samoa was trying to contain the outbreak, you were saying that it was the fault of the vaccine rather than the absence of vaccinations that caused the outbreak in Samoa in the same year you visited Samoa.
And I replied to that, Senator.
Let me just finish. The death count in Samoa grew to 83. And ultimately, volunteers in New Zealand sent tiny coffins to help bury the dozens of children who died. And the Samoan Director General of Health later said, with his last name and the status attached to it, people will believe him. People will believe Robert Kennedy.
So that was Senator Markey. This week, Samoa's prime minister criticized RFK Jr.'s vaccine views and said she's surprised by his nomination for health secretary. For more, we're joined by two guests, but we're going to begin in Apia, the capital of Samoa. We'll begin with Ione Dr. Alec Ekeroma, who is the current Director General of Health for Samoa's Health Ministry. Doctor, welcome to Democracy Now! Thanks for joining us from Samoa. Can you explain, for 2 days we've heard about Samoa, explain exactly what happened in 2019?
Thank you very much for the opportunity. In 2019, Samoa had a very low vaccination rate, and that was because of some problems back in 2018. With the mixing of vaccines that resulted in 2 deaths. And so therefore we had a low vaccination rate already. And then Kennedy visited before the measles outbreak. Now, the measles outbreak, of course, it came from New Zealand across the islands, and because of a low vaccination rate, it just took off. And so resulting in so many deaths. But the government responded, quickly, and mounted a vaccination campaign, and there was an international assistance to Samoa from all countries in the world who came across, doctors and nurses came across to Samoa to help with the mass vaccination of our people. So that drove the vaccination rate up to 90% within a few months. So Kennedy's presence in Samoa a few months before that actually emboldened the anti-vaxxers locally and also from New Zealand And so they were the ones really that tried to sow the vaccine hesitancy in the country. But fortunately, our leaders did not believe that and mounted this emergency and mass vaccination campaign.
Why did Kennedy go to Samoa?
Apparently, he came to talk about some database that they could create. But when he was here, he talked to the then Director General of Health and to the Prime Minister, but he also talked to the local anti-vaxxers as well. I'm not privy to what was discussed, but the result of his visit didn't result in any improvements in our ICT or software capabilities in the country. None was promised.
I want to bring our other guest into this conversation. As we talk to the health director in Samoa, I also want to bring Brian Deer in, who was there in 2019, in the midst of the measles outbreak. He's an investigative journalist and author of The Doctor Who Fooled the World. His recent New York Times opinion piece, "I'll Never Forget What Kennedy Did During Samoa's Measles Outbreak." So can you elaborate further on what Dr. Ekeroma is saying?
Good morning, Amy. Yes, indeed. I was out in Samoa at the time, and I spent a great deal of my time there speaking to the mothers of children who died from measles. And it was a most emotional experience. And I ended my time there just crying as I became overcome by the pain of these mothers. 83 people died, overwhelmingly small children. Now, Mr. Kennedy thinks he knows better than anybody else. He claims that he's not anti-vaccine. I've been following what is now called the anti-vaccine movement for 25 years, and I can assure you that Mr. Kennedy is not only an anti-vaccine campaigner, he is the preeminent anti-vaccine campaigner in the world. And he went to Samoa, and after the outbreak began, he then wrote to the Prime Minister trying to suggest that it wasn't in fact a virus at all that was killing these children, but was in fact the responsibility of the vaccine itself. And he didn't stop there. Even this week, speaking to senators, he claimed that nobody knows what these children died from, even though the measles the vaccine there had collapsed as a result of other issues. And then after a vaccination campaign that followed the outbreak or occurred at the same time as the outbreak, the children stopped dying. But Mr. Kennedy felt that he should tell senators that nobody knows what killed those children. Extraordinary thing for him to say.
What do you think, Brian Deer? And then I want to ask the health minister in Samoa, of him being the health secretary, the Secretary of Health and Human Services of the United States.
Well, I have to say, listening to him over the last couple of days, Amy, that I was shocked by the attitude he displayed. He was making it absolutely clear that notwithstanding him being the hoping to become the head of an agency with a $2,000 billion budget and employing 90,000 people, he was going to personally involve himself in vaccine science, and it would be he who would be deciding whether the research was conducted properly, even though he has no medical or scientific qualifications at all, and not the enormous staff he represents and the agencies that have actually written to him previously, telling him that the research overwhelmingly and conclusively shows that there is no link between vaccines and, for example, autism. He was making it absolutely clear to senators that he was going to, in that job, with those enormous responsibilities for that massive entity, he was going to involve himself in the individual pieces of research and deciding for himself whether vaccines, for example, cause autism.
And before we leave Samoa, Dr. Alec Ekeroma, if you can talk about the significance of if he is confirmed as health secretary here in the U.S.
It is quite significant. Someone who is prominent in the world with a loud hailer, spitting out anti-vaccine sentiments, emboldening anti-vaxxers around the world and in Samoa, is going to be a public health disaster for us. Already, we're going to have reduction in U.S. funding to United Nations and to WHO. That is going to affect our capability here. And then you add in propaganda into this role that is going to slow down the flow of vaccines to us, that is going to harm our public health state in this country. And so therefore, it will be a disaster for us.
Well, I want to thank you, Dr. Alec Ekeroma, for joining us, Director General of Health for Samoa's Health Ministry. Brian Deer, I want to move on to another issue. You wrote the book, The Doctor Who Fooled the World. I want to go right now to another interaction in the Senate, another exchange. This is Independent Senator Bernie Sanders questioning RFK Jr. Thursday alongside Senator Bill Cassidy, physician and key Republican vote.
I find myself in the unusual and uncomfortable position of having to agree with Senator Cassidy's line of questioning. Mr. Kennedy, in an interview in July 2023, you stated, quote, "I do believe autism does come from vaccines." And you have, the end of quote, and you have praised a gentleman named Andrew Wakefield for his research. What studies, you talk about the need to be science-based, to get our information, good information to make decisions. What studies have you utilized to come to the conclusion that vaccines cause autism?
I'm happy to sit down with you.
No, please, just answer me that.
I mean, look at the Mawson study, Senator.
The what? Yeah,
Mawson, just look at that study.
Yeah, I will, and that was published.
But I don't want to, I wouldn't rest on a single study.
Right.
And all studies can be
Okay. Don't mean to be rude. I don't have a lot of time.
Just saying
you would not be, I just heard you say you could not be happier if you were proved wrong. Mr. Chairman, I asked to put into the record 16 studies done by scientists and doctors all over the world saying that vaccines do not cause autism.
So in the last few minutes we have, Brian Deer, you wrote the book, The Doctor Who Fooled the World. You were talking about Dr. Andrew Wakefield. If you can comment on what's the connection between Robert Kennedy and Dr. Andrew Wakefield, known as the father of the anti-vaccine movement.
Well, they basically run this movement together. Kennedy, Andrew Wakefield, and another man, Del Bigtree, who works with them both, are, if you like, the innermost circle of this movement, which has evolved in recent years. Andrew Wakefield is a research cheat. He was responsible for a fraudulent study published in London in 1998 that was referred to by another senator yesterday, Maggie Hassan of New Hampshire. And she broke down as she was trying to explain that she has a developmentally challenged son, and that she had blamed herself or had agonized over whether she should blame herself for having vaccinated her son and whether it was something she had done that caused his disability. And she was breaking down there even during the hearing as she was trying to get her words out. The suffering that parents have been exposed to as a result of this man, Andrew Wakefield in particular, and his research paper that she was referring to and Bernie Sanders was referring to, published in London in 1998, and I would say was the honour of my life to have caused to be retracted and exposed for what it was.
Brian Deer, I want to thank you for being with us, investigative journalist, author of The Doctor Who Fooled the World. We'll link to your New York Times op-ed. I'll never forget what Kennedy did during Samoa's measles outbreak.